Hello medicos, today we will talk about the FGR, which is also called IUGR, intrauterine growth restriction or fetal growth restriction. So first of all, we will have to diagnose this, and how we will diagnose this, and we can simply do ultrasound, and then we can see the growth, height and estimated weight. Then we can go to the chart and assess. If it is less than the 10th percentile, then we will label it as fetal growth restriction. So there are several causes for it: maternal or placental or fetus. So, and most common cause is placental. And if we talk about the maternal causes, then we have malnutrition all over the world. So this is brief. Now what we will talk about the types. It may be symmetrical or asymmetrical. Symmetrical means if the fetus has grown proportionally, like there is equal size of head and all other body parts. Asymmetrical means there is the head size enlarged than the rest of the body if head circumference is greater than abdominal circumference. So what happens in asymmetrical is that there is a vasodilation of this uteroplacental insufficiency. So what happens is that there is a vasodilation in brain and more blood supply will go to brain, and there is the vasoconstriction in the other organs, so they will constrict and head will be enlarged. In asymmetrical, there will the proportional growth. It shows that the growth, the disorder lies in the early trimester, and it shows that in first and second trimester the growth was normal, and there is third trimester problem. So how we are going to manage it? That we can diagnose it ultrasound as well as CTG, cardiac topography, and umbilical arteries. They will be raised on Doppler, and value is greater than 3. It varies according to the WHO. So what we do in management is, sorry, I'm using the just short forms, is just quit the smoking and alcohol, drugs, any drugs, offending drugs, nutrition, improve your nutrition, and diabetes, control your diabetes if there is some gestational diabetes or whatever that is. And we will repeat CTG, bi-weekly ultrasound, and Doppler, which is umbilical. And in medications we will give, what we can give is let me tell you that there is no effective drug therapy for FGR, but low dose aspirin can prevent it. So here low dose aspirin value is 80 mg, but if the disease already established, the low dose aspirin won't have protective effect. The second medicine we can give is sildenafil, which is nitric oxide donor, which is called vasodilation and will improve uteroplacental oxygenation. Let me tell you that The prognosis is very good. Like there's less chances that the patient may be the case of cerebral palsy or mental or physical disabilities. The prognosis is much greater. Very good. So we have talked about the FGR. Now we will revise it. Like first of all, we have to diagnose this like ultrasound, height and estimated weight, CTG, umbilical Doppler will be raised, and most common cause is placental, and we will call it FGR if the weight is less than the 10th percentile, and maternal reason is malnutrition, and types symmetrical and asymmetrical. Proportionally large asymmetrical growth head will be enlarged in the rest of the body. And how we will manage is stop smoking, quit alcohol, drugs, offending drugs, stops, improve your nutrition, control your diabetes, CTG and US and Doppler bi-weekly. And what we can give in medicine is low dose aspirin, ATMG and sildenafil nitric oxide. Thank you. If you like our video, so please subscribe. Thank you.